Good day. This is Group 10. My team members are Malin Patilan Tuan, Millie Arong, Lawrence Villarreal, and John Clark Siringan. So this is the topic for medication errors. Medication errors are significant and preventable source of harm and suffering for patients, and they present a considerable challenge for healthcare professionals. A medication error can be defined as any preventable event that may cause or lead inappropriate medication is in control of the healthcare professionals, patients, or consumers. These can include errors in prescribing, dispensing, and administering or monitoring medications. The 10 rights of medication administration. First, right patient. Check the name of the prescription and wristband. Ideally, use 2 or more identifiers and ask the patient to identify themselves. Second, right medication. Check the name of the medication. Brand names should be avoided. Check the expiry date. Check the prescription, and make sure medications, especially antibiotics, are reviewed regularly. Third, right dose. Check the prescription. Confirm the appropriateness of the dose using the BNF or local guidelines. If necessary, calculate the dose and have another nurse calculate the dose as well. Fourth, right route. Again, check the order and appropriateness of the route prescribed. Confirm that the patient can take or receive the medication by the ordered route. Fifth, right time. Check the frequency of the prescribed medication. Double check that you are giving the prescribed at the correct time. And confirm when the last dose was given. Sixth, right patient education. Check if the patient understands what the medication is for, and make them aware they should contact a healthcare professional if they experience side effects or reactions. Seventh, right documentation. Ensure you have signed for the medication after it has been administered, and ensure the medication is prescribed correctly with a start and end date if appropriate. 8. Right to refuse. Ensure you have the patient consent to administer medication. Be aware the patient do have right to refuse medications if they have the capacity to do so. 9. Right assessment. Check your patient actually needs the medication. Check for contraindication and baseline observation if required. 10th, right evaluation. Ensure the medication is working the way it should, and ensure the medications are viewed regularly. Ongoing observation if required. The use of electronic health records, or EHR, has revolutionized the way healthcare professionals store and manage patient information. EHRs have become an essential tool in the healthcare industry as they provide a centralized platform for storing and retrieving patient data, improving the efficiency of healthcare services, and enhancing patient care and safety.
So yes, good morning.
Yes, good morning.
So we're calling you because we noticed a lot of medication errors here in our unit this past few days, and it's very alarming. So we are here to discuss on what we can do to avoid these medication errors.
Yes, and it's affecting our patients as well, and there are some who are having difficulty in using the system, right?
I think that we need to undergo further training on how to use EHR to avoid medication error.
That's right. So reducing documented errors in electronic health record system involves combination of technological solutions, process improvements, and user training. So we came up for some recommendation. So first one, user training and education. So we will train our nurses and other health providers on how to use the EHR system correctly, and we'll emphasize the importance of accurate and complete documentation.
Yes, you can definitely do that every month for at least 1 to 2 hours, I think.
That's correct. So also, secondly, we can also do clinical decision support tools, like we can also provide real-time alerts or reminders, which can detect potential errors or missing informations.
We could also integrate clinical guidelines into the system to assist healthcare providers in making informal decisions.
Yeah, I agree into that. So thirdly, we could also do regular audits and quality checks. We will conduct regular audits of EHR data to identify and correct errors.
Yes, and also we need to establish quality control measures to ensure the accuracy and completeness of the documented information.
That's good. So lastly, we could also have clear documentation policies. We'll develop and communicate clear documentation policies and standards to guide healthcare providers in accurate and consistent record keeping. And a feedback from every one of you is highly appreciated, okay? So remember, the success of EHR system in reducing errors depends not only on the technology itself, but also on the process and the people who are using it.
Yes, okay.
So thank you very much.
Thank you.